to part 2 of baby's best tummy time. And this is where we're going to answer a bunch of troubleshooting questions when things don't go smoothly in tummy time. So I'm assuming you've already watched the first 20 questions, so we're going to jump right into the next 10. How do I know when to help and how much to help my baby in tummy time? Some people are big on hands-off interactions with babies and letting them figure things out in their own time. And if you have a go-getter who's rocking tummy time milestones, I can totally be on board with that approach. But some babies don't fly through tummy time milestones. I'm a therapist. Hands-on helping is sort of my thing. And I know how effective even a tiny bit of facilitation can be to keep baby on track. So I have no problem encouraging parents to give baby a little help to find comfort in tummy time and to get on to the next tummy time milestones. Recently, a parent tried one of my hands-on helping techniques with baby to encourage rolling and reported back a few days later that baby was doing it on her own. And she said, "I guess some babies just need to be taught." I don't know if I've ever thought about it as teaching them how to do something. Deep down, they know. They know how to roll and lift their heads in tummy time and all the other developmental work that's hardwired into them. But there's a lot going on in their worlds and in their bodies, and our hands can act as gentle reminders of what they already know when they're having trouble remembering and when they're ready. The key is offering help for the things that are developmental next steps for baby, and that's where the tummy time milestones and the tummy time goals, remember their comfort, strength, manipulation, and movement from the basics portion of this course, are going to guide you. You'll know it's time to help if your baby appears to be struggling or if he lags behind or seems to stall out with those tummy time milestones. So let's look at some great opportunities to use your helping hands. What should I do if baby doesn't lift his head in tummy time? So some cheek down tummy time is okay. In fact, it's good. It means that baby's comfortable and able to take their own rests when they need it. That's part of being okay and feeling okay in the world. That's self-regulation, friends. Cheek down tummy time also has physical benefits, especially for newborns. But if your baby is more than a few weeks old and most or all tummy time is cheek or face to the surface, here's how you can help. Offer baby a stimulus to trigger head lifting. Your voice and novel noises are some of the most effective ones. Your face and toys that developmentally match vision can be big ones too. So remember, for babies in the first 2 months, simple black and white images or simple geometric patterns are great. If you're using a visual stimulus for head lifting, remember the simple but powerful tweak from the first portion of this course of putting objects right where baby can see them. I see so many parents place a cool visual right in front of a newborn and wonder why she's not lifting her head to see it. 1, she has no idea that it's there, and 2, even if she did, she isn't yet able to lift and hold her head centered. Remember from the tummy time milestones that brand new head lifters can lift asymmetrically, looking to the side. So you're going to want to start with an object right where baby can see while cheek down, and then you're slowly going to move it just a hair in front of baby. We're talking an inch, just enough to catch her peripheral vision. You can also help baby with head lifting by gently placing your flat hands on either side of baby's head and slowly lifting ever so slightly. Another tip for helping baby lift the head is to add movement to tummy time, and this can be while in your arms or on your lap, or this might be belly down on an exercise ball with lots of hands-on help. Gentle movement can help wake up baby's vestibular system. That's the movement sense in the inner ear that triggers head lifting. And one final tip is to increase baby's alertness before tummy time if you have a particularly sleepy or chill baby. That movement we just talked about is one way. Another is listening to or singing upbeat music with baby. And another powerful way is through your touch. So firm but relatively fast baby massage can help wake up a baby's sleeping brain and muscles. Babies are sensitive, so it doesn't take much to increase their alertness. I want you to watch your baby, and if attempts to increase alertness result in fussiness, back off and soothe your baby. Should I help position baby's arms in tummy time? Yes, this helps some baby reach the goal of tummy time comfort, but I have 2 caveats. The first is that I only want you to help position baby's arms in a developmentally appropriate position. A newborn baby's arms should be in close to or under the body with fists under shoulders. A 3 or 4 month old might be ready for elbows to be positioned on her shoulders. Look back at those tummy time milestones from the first part of this course to help your baby's arms match his head and body position. The second caveat is that as your baby gets older, usually around 4 to 6 months, and starting to help a good bit with rolling into tummy time, or maybe he's rolling independently, you might find that sometimes, or all the time, one arm gets stuck underneath his body. As long as you have a happy tummy timer who's reached the goal of comfort, you can give baby a few seconds to work on his own to free that arm. There's big time learning and strengthening going on in those seconds. Now, if help is needed, I recommend just shifting baby's weight away from the trapped arm and allow baby to do the work of freeing and positioning the arm. How can I help my baby push up through straight arms in tummy time? By around 4 to 5 months, most babies who have achieved tummy time comfort, they're beginning to press up through extended arms, at least briefly. If you aren't seeing this by 5 or 6 months and your baby's bearing weight through the forearms well with their elbows under shoulders, you can help in 2 ways. You can encourage baby to gain arm strength, and you can help her feel what weight bearing through straight arms feels like. Now, one way to do this is by elevating baby's body higher than the floor so that he bears weight down through his hands. Baby isn't pressing up actively, but gravity is pressing down passively, and this allows baby to feel the sensations of weight bearing through extended arms and to strengthen his upper body. You can achieve this position over your leg, a few stacked folded towels, a couch cushion put on the floor, and there really is an ideal height for this, but it's going to vary a little from baby to baby, so I can't tell you the magic number, but the goal is that the elbows would be straight with open hands on the floor. Around 6 months, a reflex emerges called the forward parachute reflex that you can use to your advantage. The reflex is designed to protect against falls, so it's triggered by movement of the head towards the ground, and it results in baby reaching straight arms out towards the ground with open hands and head up, which is exactly the position we're looking for when it comes to pressing up through the hands in tummy time. So that if this reflex has appeared for your baby, a simple way to play is to hold baby horizontally and lower quickly towards the ground, allowing baby to position his arms. Now, you're not scaring baby, but you're just triggering that reaction. You can continue to suspend baby's body in the air and just let him bear partial weight through those straight arms for as long as he can, or you might try lowering his body to the ground and see if he'll maintain extended arms. Have you ever noticed that when 2 people are talking and one crosses his arms or touches his face, the other will often do the same? That's because of mirror motor neurons at work. You can use these mirror motor neurons to help encourage baby to press up in tummy time by, you probably guessed it, pressing up in tummy time yourself right in front of baby. Now, this isn't guaranteed to work 100% of the time. Mirror motor neurons can't overcome insufficient arm strength, for example, but if you have a baby who's close or able to press up but just isn't quite doing it, imitation can be a great tool for encouraging. Sometimes babies just need a good reason to press up. And I've found that peekaboo is a great motivator because of the big social drive of the 5 to 8 month old. The key is to play peekaboo over an obstacle that's about a foot or a foot and a half tall so that baby's encouraged to press up and look over the obstacle to find you. Some babies resist pressing up through extended arms because they don't like the sensation of their hands on the floor. How will you know if this is your baby? Well, you might see baby press through fisted hands. You'll likely see them resistant to touch in other activities. So these are the babies who don't want to finger feed or get messy, babies who won't touch grass or mulch or sand. If you see clues like this, that your baby may not be meeting that tummy time milestone of pressing up through straight arms because his hands are sensitive to touch, a lot of your important work is going to take place outside of tummy time to address this. So you'll want to offer positive, relaxed, fun opportunities to touch as many different things as possible throughout the day. During tummy time, you might find a blanket with a texture that he tolerates and do tummy time on that. And I recommend firm baby massage or pressure to the arms and hands before you start tummy time. If you continue to see signs of touch sensitivity that are impacting baby's play and movement and eating, definitely seek the support of an OT in your area. How can I teach my baby to roll back to belly and belly to back? Well, as I've said in the first part of this course, all the work you're doing to roll baby into and out of tummy time is exactly how you're going to encourage your baby to roll. But if you've got a reluctant roller, or for Pete's sake, a baby who rolls back to belly at night and then screams because they don't know how to roll back, you might also like to throw in some rolling practice time. Like I said in the first part of the course, the way I like to encourage rolling belly to back is through facilitating weight shifts at the shoulders. As you playfully, gently, and slowly shift baby's weight back and forth, I'm often singing when I do this, you can feel it in your hands when she tries to complete the roll. Often you see the unweighted arm and leg move out toward the side, and you feel baby's weight keep shifting even though you've paused to change direction. If you feel this, wait it out and try to allow baby to finish the roll, or at least give less help. Sometimes baby will complete the roll, and sometimes it's a fake out and we go back to weight shifting. Encouraging rolling back to belly is just as simple, but there are a few other skills to consider. In order to start rolling back to belly, your baby's going to need to practice flexing or crunching the front side of the body against gravity. You'll see baby practicing this skill on his own by bringing his knees or feet up toward the chest and reaching for or grabbing his feet. If your kiddo isn't doing this flexing or crunching yet, you can encourage it by helping bring baby's feet up where he can see them and potentially reach for them. And I love using foot rattles to encourage this developmental work in a fun way. During rolling practice, you can facilitate rolling back to belly by helping baby bring his knees up, then try to entice him to turn his head in the direction of the roll, and then slowly roll him onto his side. Again, like I said in the first part of the course, you're going to pause there, see if he takes the next steps, which remember are the big ab crunch to pull his top knee and hip over and turning his face towards the ground. If he doesn't complete the roll on his own, you can help. Again, if you follow the recommendations in the first part of this No Cry Guide to Tummy Time, your baby's going to be getting lots of rolling practice. But since how can I help my baby roll is one of the most commonly asked questions I receive, I wanted to include it here as well. How can I do tummy time with my baby who has reflux? Whew, this is another biggie. Let me start off by saying I know how challenging reflux can be. Not as a mama, I've been really lucky to not face it with my own babies, but professionally I've worked with a lot of babies with reflux on feeding and tummy time and self-regulation. And I have nothing but love and empathy for parents dealing with the daily messes and the tears and the questions and the frustrations and the heartaches of having a baby with reflux. But there is a big difference between a happy or comfortable spitter and a baby with gastroesophageal reflux disease, also called GERD, which is also called reflux. So some spitting up is very, 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 very normal based on anatomy. The sphincter that closes the top of the stomach is not fully developed. So when pressure is applied to the stomach, like in tummy time, there's a good chance that a little of what's in the belly might come back up. Around 75% of infants have normal physiological reflux that isn't problematic or painful, and it typically resolves on its own. That's the reason why we all put burp cloths on our baby registries. Most babies spit up, some more than others. It is not always a sign of GERD or reflux disease. It isn't always painful. It isn't always a stomach acid issue. It's also totally normal for babies to spit up in tummy time. In fact, it's totally normal for babies to spit up and burp and fart and poop in tummy time because tummy time facilitates digestion, so you're going to see some signs of that. Unless your baby has pain with spitting up in tummy time or has significant weight gain issues and is consistently spitting up large volumes in tummy time, then you can follow the tummy time recommendations that I've laid out in the first portion of this course. Spit up and all. Put down a towel, have a stack of burp cloths handy, and if your baby spits up in tummy time but isn't upset, carry on, friends. But let's talk about GERD. Let's talk about painful, problematic reflux. It's important for you to know that there is loads of research that says that the levels of acid in a reflux baby's esophagus tends to be lower in tummy time than in flat on the back with the head of the bed elevated, or in the semi-reclined position of a car seat or rock and play. Now, I've worked with enough reflux families to know that this does not align with what they see. What they see is a baby who hates tummy time and who feels most comfortable in the car seat or the rock and play. But I want you to at least be aware and feel reassured that tummy time is not bad for babies with reflux. In fact, the conclusions of almost every research study on the topic recommend placing babies with reflux belly down after eating. Easier said than done, right? So before we get to the tummy time tips, I need to spend a minute encouraging those of you with a baby who has painful spitting up in tummy time or has weight concerns and is losing large volumes in tummy time to do everything in your power to get that reflux managed. It's really important for your baby's development to address reflux because it's almost always impacting much more than tummy time. So managing painful, problematic reflux might include having baby checked for tongue or lip ties by a professional in your area with expertise in this. This might be a lactation consultant, an ENT, a pediatric dentist, an OT, and SLP. Many, if not most, of these providers don't have experience with tethered oral tissues, so you want to look for one that does. You want to make sure baby's getting a good latch and nursing or bottle feeding well to minimize air intake. For bottle feeders, try changing to a bottle specifically designed to reduce air ingestion. For breastfeeding moms, I've seen diet changes that reduce allergens like dairy and soy to be very effective. For bottle feeders, I've seen changing formulas can have a huge impact. And in severe cases, medication can be helpful. We often hear about keeping baby upright after feeding, but research also shows that side-lying positioning is an effective strategy immediately after meals. So some research recommends right side, some left side. Basically, each benefits digestion in a different way. So it might take some experimenting to see which helps your kiddo with reflux, but neither is going to be bad. Okay, so you're working on treating the reflux separate from tummy time, but you've still got a baby with GERD who's not finding comfort in tummy time. What are you going to do? You're going to do exactly what I've outlined through this course for responsive and respectful tummy time with a baby who's still working on that tummy time goal of comfort. Babies with painful reflux very often have regulatory challenges because it's really hard to learn to be okay and feel okay in the world when you're in pain. In fact, I work with a lot of babies with reflux who have a hard time in tummy time, not because it's painful or making their reflux worse, but because they are having a really hard time coping with change and with things that are challenging because they're still working on regulation at the most basic level. So it's important to focus on that goal of comfort first and to be respectful and responsive with your tummy time, even if it means it's short. Because tummy time on your body helps your baby regulate, you may be doing more of that even if your baby isn't a newborn anymore. You may also find that your baby needs a steeper incline or to be held and rocked belly down every time to feel okay in tummy time. If your baby gets upset while you're rolling into tummy time, which might happen, your reps might just be rolling from back to sideline for a few days. Basically, you're communicating to your baby repeatedly throughout the day that he can be okay and feel okay in different positions, even if that's just for a few reps of a few seconds with lots of soothing in between. There is no tummy time failure in that. You will need to be extra observant of how the timing of tummy time in relationship to meals impacts your baby's reflux. I've worked with some refluxy babies who did really well with belly down burping sessions at a 45-degree angle on a parent's lap right after eating, and others who did better being totally upright and waiting 45 minutes before doing tummy time on the floor. In a world where we tend to track everything, calories and steps we take and hours we sleep, I encourage you to track your baby's reflux symptoms to see how changes to his schedule and his positioning impact his gut. What should I do if my baby rolls out of tummy time? The short answer is that you roll baby back in, but the long answer is we need to know more about why baby is rolling out to know how to best address this. In the early months, baby's base of support, which are his arms, are narrow. Remember our tummy time milestones. He's starting to lift his disproportionately big head higher, and if it gets outside the base of support of the arms, baby will literally fall out of tummy time, sometimes accidentally and sometimes on purpose. Now, if a happy tummy timer is log rolling out of tummy time, roll him right back in and consider it the same rep. Continue with the rep until baby tells you he needs a break. Helping to position baby's arms a little bit wider and more forward, or using props like a bobby pillow or a rolled towel can all help reduce this early rolling during some tummy time sets. Now, you don't want to totally block rolling at every single opportunity because we want babies to learn how to roll, but you also want to encourage as much tummy time as your baby's happy in. So there's a delicate balance. I recommend a mix of rolling back into tummy time some of the time and using props some of the time. Another reason for rolling is that baby's unhappy in tummy time and arching his back, which leads to an accidental or on purpose roll out of tummy time. I want you to treat this the same as if you had rolled him out of tummy time yourself, and you're going to end the rep. You're going to soothe and connect like we've talked about until baby's ready for another rep. If you've been practicing respectful, responsive tummy time for long, you've basically taught your baby the skill of repositioning himself when he needs a break. So we don't want to ignore what he's clearly communicating to us. After that tumbling log roll that young infants have comes the more graceful belly to back roll of a 4 to 7 month old that often starts with the head down instead of up. So head is down, ear to floor, and the face side arm swings up and over to roll the body. The body doesn't move anymore like one unit, like a log. It twists or rotates and looks a little bit like a corkscrew. Once baby's in this really purposeful, mature rolling stage, I like to take into much more consideration why baby is rolling. Is it to lay on the back to play with a toy that he's grabbed? Is it an attempt to move the body towards something that he wants? Is it to get a break from tummy time? And I like to honor how baby is using the roll by giving them a minute to play with the toy they just grabbed, or maybe to give them the space and maybe a little help to keep rolling towards something that they want, and of course to give a short break from tummy time if needed. Then you roll back in for another rep. You're just rolling a soothed and content baby back into tummy time as many times as he can be comfortable there. What should I do if my baby just swims or flies her arms in tummy time? Swimming or flying in tummy time, which is when the arms and legs are lifted off the floor, is actually a normal stage of tummy time that we typically expect in the 5 to 8 month range. It's big time strengthening for the back and the booty muscles, and the alternate positioning of swimming and flying and then pressing up through the arms is preparing baby for crawling. If baby swims some of the time but seems happy doing it, don't sweat it. If baby swims a lot and then gets fatigued but won't press back into the arms for a break, You can use a toy to encourage baby's arms to come forward, or you could gently try to reposition baby's arms forward if he'll let you, or you roll him out of tummy time for a break, and then when you roll him back in for his next rep, you help position his arms a little more forward. If baby's swimming in distress, arching the back and fussing, roll him out of tummy time, soothe him, and try again in a minute. If he resumes this position and is distressed, turn to props or to tummy time on your body to help him find a more comfortable tummy time position. Why does my baby hate tummy time? Some babies dislike tummy time in the beginning, but then they reach that goal of comfort. Most babies reach the big goal of comfort, and then they go through short phases of frustration in tummy time, often right before a big milestone like rolling or crawling or when teething or when getting sick. But I'd be lying if I told you that every baby will eventually be a happy tummy timer. Some never like it. So let's look at some of the most common reasons why. Maybe there was a delay before tummy time was started after the first week or two of life, so baby lacks the infant reflexes to find comfort in tummy time. Or baby is offered infrequent or inconsistent tummy time, so it feels out of the norm for him. Maybe baby has torticollis, a very common one-sided neck tightness or other muscle tightness. Maybe baby has reflux or GERD, and this can lead to disliking tummy time like we talked about due to several factors. Maybe it's painful to be in that position. Maybe they have regulatory issues that are so common with reflux. Maybe their parent is avoiding spit-up inducing activities or activities that might upset their fussy baby, and that leads to a lack of tummy time normalcy, or they could have a combination of all of these factors. Or perhaps happy spitting and the normal reflex of infancy makes a parent think that they should be avoiding tummy time. Maybe baby has tethered oral tissues like a tongue tie or lip tie. These often cause tightness or restrictions in other muscles that can make tummy time less comfortable. Maybe baby has sensory processing difficulties, and these are typically not diagnosed in young infants, but instead they present as regulatory issues, babies who have trouble being okay and feeling okay in the world. Very often the connection between sensory problems and tummy time are only discovered through the evaluation of kids well beyond babyhood for sensory issues. Maybe baby has regulatory issues that we've talked about so much. This can be with any baby, but especially babies with colic, with preemies, and with babies who experience birth trauma. Maybe there's some frustrating toy placement or a lack of interesting things to engage with going on. We've talked about how tummy time is just a position and you have to add something to make it play. A belly down baby without stimulation is very likely to protest. Maybe there's a learned association with misery. This is one of many reasons why respectful, responsive tummy time is so important. If you have been letting your baby cry in tummy time, please know that it is not too late to turn the ship around. Start today making tummy time a no-cry zone and offer it often to unlearn that association. What if, despite all my best efforts, my baby never tolerates much tummy time? Even if your baby isn't digging tummy time, I want you to keep offering 1 to 2 sets of respectful, responsive tummy time during each daytime awake period until your baby's able to transition from the floor to sit or until he begins to crawl. You're going to use all the tips and strategies from the tummy time basics portion of this course to help baby feel more comfortable. Tummy time on your body, carried or held, tummy time on an incline, connecting with baby, strategic positioning of toys, and novelty. But if you have a baby who seems to not be mastering this goal of tummy time comfort after weeks or months of offering respectful, responsive tummy time as I've described it, you aren't alone. There is a small subset of babies that just never get comfortable belly down. I encourage you to get really curious about what might be the root cause of that. Now, don't let it send you into panicky, anxious, worst-case scenario mom mode, but I want you to let it send you into curious, detective mom mode. Maybe you'll never know why, but maybe, just maybe, you'll notice some clues. Notice, does baby have a hard time regulating himself or herself? That usually means a generally fussy baby who is easily upset and hard to soothe. Does baby have a positional preference or strong dominances, like a head-turning preference, rolling only one direction, using one arm or leg more than the other? Does baby resist movement or position changes in other activities like bath time or diaper changes? Does baby resist getting hands messy or seem sensitive to touch? Does baby keep his hands fisted instead of open during tummy time at 6 months of age? Is baby also having nursing or feeding issues that could signal an oral issue? Look back at the reasons I listed for some babies never liking tummy time and see if any of those ring true for your baby. Discuss any patterns you notice with your child's doctor. And finally, if your baby never builds up to much tummy time, be sure that in toddler and preschool years, you offer lots of crawling play, upper body strengthening play, and tummy time. That's right. You can offer tummy time to older kids. Think about it. While they're reading, while they're coloring, while they're watching a show, for example. I've linked below this video to a blog post that describes great activities for babies who skipped crawling, but the same apply to babies who missed tummy time. In closing, notice, support, facilitate, problem solve, celebrate, and know that I am rooting for you and your baby to have comfortable, happy, connected tummy times together.